Hello, everyone. It's Dr. Jensen from Dean's Chat. If you're on the fence as to whether you want to join the American Podiatric Medical Association, jump on in. It's a new APMA. Whether it's advocacy concerns, scope of practice, billing and coding, consider membership at the APMA as your professional insurance. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. And Happy New Year to everybody out there. This is our first recording that we've done in a couple weeks, so we're excited to get back into the groove. Once again, we are going to be taking over, so to speak, an APMA news takeover with Dr. John Garnett being the host. Dr. Johanna Richey and I are going to try to answer the questions to the best of our ability. Hope you liked the first episode. I saw that we put it out a few days ago, and it's gotten a lot of traction already, so that's a good thing. Hopefully we can continue that trend. The floor is yours, John.
Excellent. Well, thank you again for letting us take over. Just to shout out that in the January, February APA News, we will have an article on part 1. March, April, we will have part 2 as well. So get to see a little summary of it as well. But today we're going to have some of the big guns come in and some of the meat of the conversation, really focused on student recruitment, the kind of trajectory of the profession, and then also the role of APMA in that trajectory. So again, I will be asking some questions for some of our APMA members and students. And the first one comes from Tyler Daly, who is the American Podiatric Medical Students Association liaison to the APMA Board of Trustees. Tyler asks, student recruitment has been an ongoing challenge across the healthcare field, including podiatry. Do you think our current efforts to increase student recruitment are adequate or effective? If so, when do you think we'll see the results from those efforts? And if not, what do you think would be an appropriate way to improve our outreach as a profession to increase student enrollment?
That's a mouthful, Joe. That's an onion that needs lots of layers taken away. Tyler's fabulous. We know Tyler. We've interviewed Tyler, and he's been on Dean's Chat. Joe, you want me to take this one from the top?
Yeah, you start this one, because I know this is a passion project of yours for several years now.
It is a passion project. And we mentioned earlier on the first episode that one of the reasons we started the podcast was to increase awareness of the profession and highlight students and residents and practitioners. And that's just one little part of student recruitment efforts that the profession's made. And a lot of this occurred after COVID. And as we mentioned earlier, when COVID hit, all of a sudden, prospective students had nowhere to shadow. And it's that shadowing experience that students find to be so worthwhile, where I'll steal a word from you, John, they have that epiphany about the possibility of becoming a podiatric surgeon. And so if you look at it from that perspective, it kind of explains a lot of the work that we've been doing. So, for example, through AACPM, which is the American Association of the Colleges of Podiatric Medicine, it includes all 11 colleges, it includes all 220 residency programs. All of us want to move forward in trying to recruit the best possible applicants for each class. So, knowing full well that getting students into podiatry offices to shadow was so important, we initiated a project called Feet on the Street. And Feet on the Street was, was a program where we would kind of take all 11 colleges, and each college would be responsible for 20 different other undergraduate institutions or universities or even graduate medical programs where we could go in and give a talk about podiatric medicine, perhaps, do a suture workshop or give a lecture, but really just highlight the profession and have a local podiatrist there that could be the shadowing doctor. So oftentimes, if you go into a university and you give a lecture and you leave, you're there, you're gone, out of sight, out of mind. But by bringing in a doctor from the community who's willing to let these students shadow in his office, the thought being they would have a tremendous experience. They would see what a podiatrist does firsthand, just driving down the street instead of waiting to go home for the summer or something. And all the schools, we could cast out a fairly big net across the country when you look at the geographical locations of the colleges of podiatric medicine. And included in that would be, and we've done this a lot in Colorado, for example, where we bring in a residency program where they have students or residents and their faculty. So there's areas the country that we've really worked hard at kind of opening up, if you will. And we're hopeful that over time, those students will indeed apply to podiatry school. But for example, when we go to those programs, and we may be talking to first-year students or second-year students or third-year students, or in case this year, I usually go up to Montana because it's kind of one of our states for the Arizona school. I couldn't go because I had knee surgery, but I gave a talk. I gave a talk to their interprofessional class. And it's funny because I've been there 2 years prior, but I had all these great questions, and we were doing it on a Zoom meeting. And then the counselor sent me a note she said, most of these students didn't even know podiatry existed, and some of them are open to looking at podiatry as a future healthcare option. And so our work never ends, right? I mean, it's like classic marketing. You got to show something 7 times. So if you show up once and you say, "Hey, look at podiatry," that's not enough. You have to develop relationships and get those pipelines, if you will, with other universities. So that was the feet on the street effort, and there's more than that. There's podiatrists for a day efforts, and AACPM does other efforts with local docs. So there's a lot of effort through the association. Joe, I sense I'm talking too much, but let me just go to another. I'll do the JPA effort through the Foundation for Podiatric Medical Education. This was founded maybe 3 or 4 years ago. Dr. Patrick DeHeer was heading it up. Pat, as you know, is going to be the president of the American Podiatric Medical Association next year. It was really Pat's passion project to use data and get companies, professional marketing companies involved with podiatry, understanding what we are, doing all of the questionnaires, if you will, to undergraduate students to find out what they're interested in when they go into medicine, or if they've thought about podiatry or not, and if not, why not? So we did a lot of background work, and now, starting in October of this year, we have a massive social media platform where we are advocating for podiatric medicine. Podiatrists move the world. That's one of the taglines. And we don't know what the results are going to be yet, because we're on YouTube and we're on Instagram and we're on TikTok. And as you know, you can really dial in demographically the exact people you're looking for. So you can go to areas surrounding the schools, because we know that where there's a school, there's an increase in applicant pool. We can go to undergraduate institutions. We can highlight MCAT takers. We can highlight basic science majors. We can highlight exercise physiology majors. You can really target where your ads are going. So it's completely a work in progress right now. And hopefully we'll have funding for it through the recruitment cycle of 2025-2026, which ends in June. But it's kind of a 2-part effort. If you can get people aware of what podiatry is, and then they actually go to a local school where they see a podiatrist come in and have an opportunity to shadow, they all kind of feed upon each other. And that's not to discount other efforts, right? There's other efforts local podiatrists are doing, state associations are doing, oftentimes going into undergraduate institutions and kind of highlighting our profession in an interprofessional class or something like that. So that's the first part about what's out there. Joe, you want to add to that at all?
No, I think that was a really nice summary of a bunch of different facets and trying to meet people where they are and where the most impact will be.
Well, then the next question is where it gets sticky, though, John. Is what we're doing enough? And I will tell you, I don't think it is. The biggest challenge we're having right now, and it was probably Megan McClellan that just, hit the bullseye. She said, I've been in the hospital world in Maryland before she came to APMA. And she said, nobody knows who you are and nobody knows the great things that you're doing. And that was from somebody within the hospital realm. And so to her point, and she's very proactive and she's very thoughtful and she's very strategic. I fully back an effort to brand the profession, not a marketing campaign, but a branding campaign that highlights our profession, so that it's when students are introduced to podiatric medicine, you don't get that, kind of look, or what's that? Are you treating babies or something? We don't want that. We want them to understand that podiatry is all things foot and ankle. And until we get that acknowledgement, I think within the American populace, it's very hard because Joe and I have gone to all these undergraduate institutions. You go in there and you're trying to educate them about podiatry, not recruiting them to your school. So it's hard to do both. Whereas if you're in another profession, you're recruiting them to your school because they know what they're getting into. But we're trying to define what the profession is and then recruit them. And that's a tall effort. Because changing people's minds when they've had it in their brain, they're going to be an ER doc or a orthopedic surgeon or a radiologist. And when you throw podiatry on the table, like, well, what's that? So I think the branding effort is required. And I think that the leaders in our profession, many of the groups, whether you're talking about the American Board of Foot and Ankle Surgeons, American College of Foot and Ankle Surgeons, American Board of Podiatric Medicine, all of these groups come together, the AA, APMA, we need to be on the same page. Branding our profession so that the American public know what we do and who we are, to not just help the profession, but to help the multitude of patients that have foot and ankle issues out there. So I wanted to add that, Joe.
Yeah, and I think your point about we're not trying to convince people to become podiatrists. We're just really wanting to let people know what it is as a career opportunity. And, there have been several surveys now that have gone out about compensation and job satisfaction, things that are important to young students looking to craft not just a job that they do, but something that they take pride in, and having the opportunity to impact someone's life and see those results in real time. That is why I think we have such job satisfaction. So without, just saying everything that Jeff just said, what I think has been a little bit of a challenge is when you're having to explain what podiatry is and then talk about why someone should come as a student, it's almost like there's so much clunkiness. It's too sticky. And so because these two things do go interchangeably, I think it's going to be hard to know, again, like right away, this is not something we're going to see results in the next 1 to 2 years. I mean, we're looking at more of a long-term strategic plan. But Jeff and I already see the results of this. We can already, when we talk to some of these students that apply, we hear from them the stories of those that are already introduced to podiatry. They already know what it is and how it impacted as they looked at all different kinds of opportunities in healthcare, what it was that podiatry brought to them that they were like, this is why it resonates with me. And then we see from students that didn't know what it was. They had wanted to do something in healthcare, but they weren't really sure what it was. And then in late part of their career or their schooling, they find this, podiatry career. And so hearing the different stories, it's not that one is better than the other. It's just making sure that there is awareness out there because there's so much need in the community for what we provide. And so having opportunities out there for students that are interested to connect them to the right places, there's so much opportunity out there. And so it's been really fun and exciting to hear from students and prospective students about where they are finding information so that, to Jeff's point, we can meet them where they are and try to, again, every touch point matters, but how do you subscribe credit, right? Like somebody listens to a YouTube video, or somebody goes on a website, or somebody goes to a suture event or a college application committee. Like, how do you know which one of those is the moment, right? That sparked that's what I want to do. And I don't think that it matters, but these are the questions that, again, over time will be important for us to try to at least piece out to figure out, okay, well, what is working and maybe what isn't as effective. So.
John, I just want to add one other thing. Sure. So Joe and I have been talking about internal factors that affect recruiting, right? But there's a lot of external factors. The entire healthcare, education beyond high school is really struggling right now. When we talk to chancellors of undergraduate institutions, their competition isn't among themselves, it's with the workforce. So we talk about an enrollment cliff at the universities. If you start narrowing the funnel and there's fewer students going to college and fewer students going into medicine, just as an example, or in general, just because of the decreased numbers. And then you see on the other hand, since 2020, there have been 12 osteopathic medical schools opening, and all of them take 150 to 200 plus students. So there's lots of competition for the best students. It doesn't matter if it's dental, podiatry, pharmacy, MD, DO, veterinary, you name it. There's only so many bodies to go around. So I think our job is to put our profession front and center, get the American public to see what we can do to help in the foot and ankle realm, and then go from there. Because I don't think you can't sell anything to somebody, or you can't convince them. To Joe's point, you can't even really highlight it to them if it's just honest, if they're not aware of it. So it's a challenge. I mean, it's not a challenge that we can't meet, though. And leaders like Megan are exactly what we need right now, with vision, forward vision, to keep. We're going to talk about APMA later, but they do an incredible job in so many facets of representing our profession in many different arenas. This is just one of them.
Yeah, no, I mean, I think that visibility is key, as you guys said. Kind of thinking, if a patient is treated in the woods and nobody's around to see them being treated, does anybody know that they actually were treated, right? To kind of, mix some metaphors there. And I think that's a big one. And I think, it's great you guys talking about like the grassroots efforts you guys do, and all, as well as kind of the data-driven approach, because like you said, you can't just pick one track and just say, that's how we're going to gain back these students. It's going to be 10 different tracks, and you're going to get 15% from here, maybe, and 20% from here, and 3% from here. Then you add it all up, and you don't have a student recruitment crisis anymore. So, that's great that you guys are like thinking at it from like a really wide angle lens. Next question I have is from Dr. Priya Parthasarathi, Chair of APMA Communications Committee. And she would like to know, how should we be communicating the value and importance of podiatry to prospective students? What mediums do you think resonate, and what messages do you think resonate? So like, is there a certain type of message that you think you see that students kind of grasp upon? Maybe it's quality of life. Maybe it's the range of things you get to do as a podiatrist. That's something that was really interesting to me, was realizing all that podiatrists could do. And I hear that from, prospective students and, DPMs, where they say, I didn't realize until I realized, and then I knew it was the job for me.
Joe, you want to take that one?
Sure. Yeah. I think one of the most important things is knowing what you want to get out of your life, right? Like, how do you construct the building blocks to design the life that you want to live? And I think this looks different for everyone. And that doesn't mean that we need to try to all conform to the same thing. But what I think is such a valuable opportunity in podiatry is this: we don't all have to do the same thing. We don't all have to act the same way or do the same specialty, even within a specialty area. And so I think it's important that when we talk about our profession, that we support each other and we lift each other up, because that is what the world is looking at, right? It's hard for us to defend what we do if we're tearing each other apart. And so I think when I talk with younger people, the things that are really important to them, the things that they're looking for, they want meaningful work. They want something that they wake up and they are excited to do, that gives them the kind of satisfaction, and it gives them a craft that they can refine over time and get really expert type status. And those are all absolutely things that we do in podiatry. And then to Jeff's point earlier, the other really nice thing about the educational pathway, which is distinctly different than the MD-DO route, is you're specializing right out the gate. And again, for some people, that's not what they want. They don't know what they want to do, and that's fine. We're not trying to convince people that everyone should be podiatrists, right? But for some students, they want that, sure thing. They want to know what they're doing so that they can start that focused training right from the beginning. They like the idea of a streamlined educational pathway. And so again, from students that knew what podiatrists were, but didn't realize perhaps that it was a separate educational tract, that has been something that was kind of an aha for them. Like, I didn't even realize that it was a separate thing from DO or MD until I started asking all the kind of questions. And so I think being able to really help people realize that there is an opportunity to create a a work-life alignment. Again, I hate the word balance, but a work-life alignment where you can have the kind of career that supports you in job satisfaction, but also helps support you in the life that you want to live outside your job. And that can look different for everyone. You could work in a hospital setting. You could work in a private practice. You could work in a multi-specialty clinic. You could work at a wound care center. There are lots of different ways to achieve that goal. It just depends on what you as an individual want out of that experience and where your interests are. And I think that's a huge benefit of podiatry.
Well said, Joe. May I tag on with that a little bit? So, case in point, we interviewed 2 students today, one from South Dakota, one from Washington. They were wonderful students. The common theme today, when I interviewed them, is the common theme we hear all the time. When they shadowed podiatrists, they found the happiest doctors of all the specialties that they had the opportunity to shadow. They loved their life, they loved their patients loved them, they were doing things that they loved to do. There was a work-life balance, and to your point, Joe, that's not the greatest term in the world, but if you want to work 24 hours a day, you can. You can write papers. You can work in an academic health center. If you want to limit your hours, that's fine. I've told students, if you want to surf the North Shore of Hawaii, go for it. You can have more. You can have afternoon office hours or something. So you can really tailor your position to what you want to do. You can't say that about all specialties. That's for sure. So I just wanted to add that because that is a common theme that I hear from students, and I've been hearing that for years. So the more students we can get into podiatrist's office to shadow, the more students we're going to have applying to the schools.
Yeah, I like that. One of the things I remember growing up, you were always told kind of follow your passions, and now there's kind of been a shift to more thinking along, your passions can be your hobbies. How do I support those with my career? And that's like a really smart way that I think, APMA podiatrists are kind of framing the profession. Exactly what you said, you can make it your passion, but if it's like, some people just might never ever have a passion, right? And so like they want to find a job where it hits all these different things, like intellectually, the skills they do, the schedule. And I think, podiatry really has a lot to offer in that flexibility. So that's I think a really great message that's resonating.
Did you know APMA provides help with public health initiatives such as fall prevention, opioid abuse prevention, and addressing health disparities?
Did you know the APMA provides over $400,000 in scholarships annually to students pursuing podiatric medicine, helping the next generation of foot and ankle specialists?
If you're serious about this profession, if you want to grow, to lead, to make a lasting impact, join APMA today.
All right, so next question is, how do you think we can reach individuals with diverse backgrounds to attract them to the profession? And why do you think, recruiting podiatrists or podiatric medical students from more diverse backgrounds will benefit the profession?
I'll start, Joe. All of us have a desire to be treated and have our doctors resemble us, right, and relate to us and understand us and what we're going through. You could use it from a diversity perspective, but you could even you could use it from a specialty perspective. Case in point, if you're a runner, it makes sense you're going to go to the running foot doctor, right? That's another way of looking at it. So, we've made tremendous efforts to increase our representation within podiatric medicine and made tremendous efforts over the last 20 years. You can go even talk about male-female relationship. We have more females applying to the schools than males at this point. And so I think representation across the board of every nationality is appropriate, because if they're going to be treating patients of similar origin, nationality, they want to be treated by doctors that they can relate to. So I think it makes a lot of sense, and I think we're doing it actually. And in fact, Joe, if you look at all the parameters of things that we really want to do in our profession, that's when we're really hitting out of the park. Yeah,
and again, I think that's something that is important for students to be aware of. that there is so much opportunity for everyone in podiatry. And the studies have shown the diversity in the workforce improves patient outcomes. When patients see themselves represented by their doctors, there's more trust, there's more compliance, there's more collegiality amongst each other, there is better collaboration. Like, there's so many benefits to having an inclusive workforce on both the provider and the patient side, that this is just something that, again, should only continue. The world is continuing to get more and more diverse, and we need to continue to represent that. And I love that podiatry has been moving into that space. I think the things that I'm the most excited about in the future are the opportunities that are being opened up more in leadership opportunities, with more diversity being included. So much of our patient populations need that representation, and they need that expertise. And who better to lead that way than the people that are doing that work? So those are things that I'm pretty excited about, as they're continuing to improve. We're not quite where I think a lot of people would like to be, myself included, but it's only getting brighter. So I think those are optimistic things for the future.
Excellent. No, fantastic. Next question comes from Mallory O'Connor of the APMA Student Engagement Committee. While student recruitment is important, what about student retention? What does student retention look like at your institution? And, if you've heard about it at other institutions, and how do you think we should support podiatric medical students and potentially residents?
Joey, you want me to start?
Sure. I'm like, this is a tricky question for sure.
Well, I love it because, one of the things, we exist for our students to be successful. I mean, if that's all we really exist for, that's why I have a job as a dean and Joe's faculty. And we do everything we can, even from before the time they show up on campus, with pre-matriculation, information and mini courses in different areas of basic sciences. But we owe it to those students to give them an opportunity. We also owe it to them when we interview them and assess them if they will be a good fit and likely be successful, right? So there's a lot of things going on here. So once they come to Midwestern University, and this is true for all of the schools, we do everything we can to assist them to be successful. And a lot of it starts with the faculty, open door policies, student services, tutoring facility, different levels of tutoring, mental health concerns. It's a very stressful environment, right? And when they go into podiatry school, at our school, it's the medical school curriculum. They're right seated next to the DO students. There's 300 of them in the basic sciences, and there's nothing easy about it. So I think our job is to help students reach their potential. And that's why I always tell the students, we're on the quarter system. In the first quarter or two, they're learning how they learn, how they study best. And we facilitate that in any way we can. Now, all jokes aside, I always tell our students, I can't help you with biochemistry. I'm sorry. I took that a long time ago. But we do have tutors, and we do have a phenomenal basic science faculty. And then when they get into the clinical world, or the podiatry pillars, as we say, of our education, and when they start looking at what they want to, where they might want to do clerkships, where they might want to do a residency, we really, that's why we're here. That's why we exist. So I think that the student retention is crucial. We give them every possible chance to be successful. And if a student comes in and works hard and treats it like a job, and they're very passionate. You got to be passionate, because it's hard. If you're not passionate, it's hard to succeed. The path is there for them to be wildly successful. So retention's incredibly important, and because we don't want to waste their time. We don't want them to come here and leave. That doesn't make any sense. So anything we can do to help them be successful, it's really our job.
But to that point, and this is where some of the, again, I think of it as, I think it's Kim Scott wrote the book Radical Candor. This idea of you have ruinous empathy, right? Like, oh, I don't want to hurt anyone's feelings. Yeah. I want to just be kind, but that's not kind. That's just being nice. That's just sweeping it under the rug, right? If I have spinach in my teeth and I'm about to go do a live television thing, I want someone to make me feel really awkward and uncomfortable and be like, I'm sorry, Joe, you've got something in your teeth, right? It's a moment of difficult uncomfortableness, that's actually going to save me from a much more humiliating experience.
Yeah.
And Jeff, I think we should say this, because it's not to say that our profession is bad, but I think some of the challenges that we face as a profession is looking at this idea of what excellence is. We are an amazing specialty, but we also need to be mindful that excellence comes at a cost. And that is an investment in it's not a job. This is a craft. This is a profession that you spend your life getting better and better at. And none of us ever get to the point of perfection, right? But that's not the point. The point is the pursuit of the excellence. And if we start lowering a standard and saying, well, it's okay that you weren't able to cut it. Let's just open up this let's just do this for you instead. Like that's where you got to take the kid gloves off at some point. And I feel like it's so unfair as a student to be handled with kid gloves, and then you get thrust into rotations where the real world hits you in the face. And having talked with students that get a really big dose of reality, that's incredibly jarring and way harder on them than if we do a little bit better job of getting them mentally prepared for what this looks like. In our first part one, Jeff or John, we talked a little bit about this idea of expectation and aligning expectations. And again, that is something that I think is only going to get harder if we're not adequately preparing students. But we can only do so much. Students need to be prepared, either mentally, emotionally, spiritually, whatever you want to say. And again, for some of them, it's just not going to be in the cards. And that's okay. It doesn't mean they're bad people, but that just means that this wasn't for you. Go find the thing that's for you, but figure this out early rather than carrying it on and then being perhaps one of those disgruntled people on the internet.
Yeah, I kind of think, again, like I remember when I was 13, I got a participation trophy for the first time in a soccer all-star tournament, and we got destroyed. I was so confused why we were getting like a small trophy. I was like, we just lost like every game 6-0. I think that was like, if you kind of keep getting participation trophies at some point, then you actually play in a real game and then you're just not prepared. And so it's hard, I think, when you're in the educational system when a lot of culture has also become like that, to like fight against that with like something so meaningful. So I understand the struggle there. All right. So, yeah. All right. So now we're bringing in some of the big guns here, and some of the questions on APMA, and we'll start with APMA President Dr. Brooke Bisbee, who asked, student recruitment aside, what do you think are the most pressing challenges the profession is facing today, and why is APMA's work so important in addressing these challenges?
Ooh. This is the big gun episode. Do you want to start, Jeff, or I can keep on my rant?
Maybe this will be the clickbait episode that you guys haven't done yet,
No,
like Joe and Jeff get mad,
No. Or tell it like it is, maybe.
Exactly. Not mad. Yeah, definitely not mad.
So I think all of the medical community has some challenges, right? I mean, you just look at the insurance industry, look at pre-authorizations as a patient, and you can see the challenges that we have. And as a doctor, you're right in the middle of it. You're right in the middle of the care, the quality, the getting pre-authorization to get the appropriate tests, getting the surgery approved, getting the billing appropriate. The doctors are in the middle of the eye of the hurricane, if you will. And so what APMA does really addresses all of the areas that we can address on our own. I mean, if you look at who represents us as podiatrists across the board at every level, it's APMA. It's APMA if you're talking about political things. It's APMA if you're talking about economic issues and billing with CMS. It's APMA when you talk about relationships with the other professions. It's APMA even when you talk about clinical things. I mean, for example, the Journal of the American Podiatric Medical Association. That's what we hang ourselves on, right? That's the APMA. So I think that all of these things are teetering at different times, and it's like a lot of balls in the air. So which one do we have to address at this second? And APMA, I think, is under tremendous leadership. I think that they don't take their eye off the ball. They understand what they're dealing with, and then they're bringing in the different areas of the profession that help them in every scenario. And I think that's important because there's so many talented people. So you're asking me if I could point to one thing. I think advocacy is huge. Who else advocates for our profession other than APMA? Most people are advocating for themselves. APMA advocates for all of us. So I think that if that's one thing that is most important, I think they're doing a great job of it, actually. And I think that all the CMS issues are tremendously important. But at the end of the day, APMA represents our profession, and I think they're doing a great job.
Yeah, I would just piggyback on that. The advocacy efforts of APMA, I think, are completely unmatched with any other professional organization. And we really need experts in that space that follow these changes, that can be strategic about perhaps things that are going up for a vote, so that hopefully bad legislation doesn't even get to the table. But then if something does happen, having people that, again, can respond quickly, and this is their job, is to look at these things and act quickly and efficiently in the best of the profession. Again, it's not an individual interest. It's our profession as a whole. And we don't really have that outside of the APMA, which is why I think their role is so pivotal. And certainly because we have other individual organizations, they are like the umbrella organization. So I think one of the biggest challenges certainly is some of the unity. And again, it doesn't mean we all have to agree on everything, but bringing us together as organizations under APMA, under the profession of podiatry, is a huge task. And I think that the leadership has been doing a wonderful job in just starting the build, like reaching out that olive branch, starting those discussions, starting these conversations, starting collaborative efforts to continue to unite us, because we are better together, and figuring out how do we leverage each other's strengths and build together rather than just keep slinging mud across the aisles. And so I think not only do they have the legislative part of advocacy, but then the uniting of us as a profession, I think, is another task that maybe inadvertently or maybe very intentionally has been taken on. And I really commend that effort, because I think, again, that's a really important one for us moving forward in the future.
Yeah, I always think too, when you have like a regulation that's being proposed, if you're on top of it and really reading into the details and thinking through in 5 years, what does this mean? You can stop certain things from being implemented that maybe even politicians didn't want. But in 5 years, it's too late, because then, it's much harder. The inertia to get that ball rolling again is very difficult. So like really being on top of these changes early is really hugely influential. So I think, just my personal experience noticing like a lot of the work we do has been, really impressed with that.
Like Randy Kaplan says, if you don't have a seat at the table, you'll find yourself on the menu. Didn't we talk about, maybe we talked about that last time even. So true though. It's absolute fact.
No, it's absolutely, yep. I completely agree. I love that. I love that saying. All right. So this one comes from Dr. Bisbee as well as CEO Megan McClelland. What would you tell a non-member when trying to recruit them to join APMA? So do you have any advice for us on how we can make that pitch to non-members that might not think it's important?
Joan, you want to go first, or would you like me to?
Sure. I'll take this. I'm probably the newest of the members. I mean, not now. It's been over a year, but I think the more we talk about shared experiences, there are headaches and problems that impact everyone, and they're shared things. But there are some things that you can, if there's something that is sticky in your life or your practice, and you want to find ways to help move the needle and have an opportunity to have, productive impact, the APMA is a place to get that ball rolling. And there are so many different opportunities to get involved and to have your voice heard that would be, in my mind, one of the biggest reasons to join, is to have this collective group of people that, like, I may not know how to answer your question, but I can put you in touch with somebody that does. And depending on, again, where your interests or your headaches are, you can align your time with the things that give the most impact. And that then provides, again, more job satisfaction. And then you get the positive repercussions of, hey, look, we actually just had a real change. That legislation was reversed or changed, or we got something with pay equity, whatever it is, right? You get to be a part of the solution rather than just feeling like things are happening to you.
Mm-hmm.
And I think all of us can appreciate that. So I think having that just community of support and opportunity to engage is a huge benefit of being an APMA member.
I agree. And the irony of it all is, if you're not an APMA member, you still get all the benefits of the hard work that the members and APMA does.
We're going to cut. That has to be cut. We got to cut that.
It could be a hard sell, though. But I mean, I'll add to that, though. I mean, who wants to be that person, right? Who wants to be the person just, taking advantage of a situation that doesn't make any sense? You want to be part of the solution. You want to work hard so that the benefits you do get are hard earned, and you're part of that. So my point is, there's always going to be people like that, but that nobody really desires that. I mean, when you look at some of the things that have happened with CMS over the last 5 years, 1 year alone with billing codes that were changed in our favor probably covered your entire lifetime of APMA dues. So, I mean, it's that and advocacy and scope of practice in different states. And I mean, there's so much effort that goes in, and a lot of people are working hard. They're not getting paid for the work they're doing. They're working hard for the betterment of a wonderful profession. So I can edit that part, but it happens. It happens. But I mean, I don't know what you do about that, right? I mean, you have to appeal to everybody that we want the best for our profession as a whole. And I think what Joe talked about, the internal strife sometimes, you just got to be careful that we don't take our eye off the external ball, the big picture, because you can get caught up in family struggles, so to speak, in-house struggles, and that doesn't really benefit the profession in the long run. So those things need to be addressed, but they can't be front and center.
No, we got some bulletin board material for APMA membership now that we might have to get get some signatures from you guys so we can use that in the future. But that was all I had for the interview. I appreciate the takeover. The only last question I have at the end is, do you have any exciting new things or directions you're thinking of taking the podcast or this duo? We're going to see TikTok dances in the future, maybe, anything interesting that you'd like to maybe let everybody know about early on?
It wouldn't be a surprise, John, if we told everybody what our plans were. Just kidding. Joe, your thoughts?
Yeah, no, there are several things we have in the works, but none that are yet ready for announcement type material. But I think it'd be fun to start a gratitude challenge. So
I like that.
Yeah, do a gratitude. I mean, so where that came from, I had a student from several years ago. She's a resident now. Send me an email over the break with just a thank you about a lecture that I had given, and she sent me these X-rays of a reduction that she had done on a talonavicular joint dislocation, and it was just such a beautiful moment of gratitude. And of course, then I was like, I need to thank all my teachers, because it was such a wonderful feeling to have somebody say thank you. Because she could have had the moment of thinking, oh, that was great. I'm so glad she taught me that, and then never have to send me anything. Right. But anyway, now we have a whole email. We sparked up a whole conversation. So, but I think a gratitude challenge would be a great way to start the new year. So email one of your teachers and tell them how much you appreciate them.
I like that. I like that. And so John, we were going to talk about your books behind you and talk about your career, but with how long have you been with APMA now?
Since July.
Since July. Okay.
Yeah.
So maybe what we could do, if you'd be willing, Joe and I can go back into asking the questions, and we have you on as a guest over the next month or two. And because I'm dying to find out all the fun things you're doing, because I mean, you've got like a clean slate. You get to just create fun stuff, and I love that.
Yep.
It's got to be a very enjoyable position.
And your background of a medical historian, I think, if I remember correctly,
Yep.
like, come on, that's
History of science and technology and medicine.
Yeah, I can't not ask you like a million things about that. So
yeah, so Joe, we can't give him like 2 minutes. Let's do a whole episode. We'll do it in a couple of months, and we'll get you on the schedule and talk about all you're doing and your background and how that kind of lends itself into your current role.
Yeah, that sounds great. I'd love to. So pay forward or pay back to you guys for all your 2 episodes, doubled it up. So I really appreciate all your time for letting us take over.
No problem. We're talkative. We're chatty Cathys. So, all right. Well,
we don't often get to have a controversial conversation. So
yeah, I still haven't decided if I'm going to keep that in there yet, Joe. All right, everybody.
Maybe you can have like a unedited version.
Right. We'll put a pay-per-view.
Uncensored, where they call they have like like those shows where it's like Naked and Afraid, uncensored.
Yep. Well, we'll see how it goes. Well, let me think about it. Anyway, to all of our listeners out there, we so appreciate you hanging in there with Dean's Chat. My gosh, this is our 4th year, Joe. 2023, 2024, 2025. 2026 has a lot to offer, and we are excited about Dean's Chat. And we do have a couple of really cool things coming up, and Joe and I will share that in future episodes. But if you're listening on Apple or Spotify, we appreciate you listening, and we'd love to have a comment or two. Joe and I get lots of, like little check boxes and number assessments, but we want comments. So if you can give us comments, that'd be great. And if you're on YouTube, by all means, become a subscriber. We'd love to have you seen all of our videos. And John, we can't thank you enough for jumping on board and hanging out with us on Dean's Chat and flipping the script. APMA News Takeover. Thank you.
Yes, thank you.
So Joe, I'm going to send you 2 cups because, like we said, you're going to need one at home in that beautiful office and one at work.
Love it.
Right, sounds great. All right. Cheers, everybody. Bye-bye.
All right.
bye-bye.